He is a nationally certified medico-legal death investigator, a research scientist, and every night he's a first responder here in the Low Country. Now, Frank Broccolo wants to be the next Charleston County Coroner. I speak exclusively with Frank for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and follow me on social media. Frank Broccolo, welcome to Quintin's Close-Ups.
Thank you, Quintin, for having me.
You're very welcome. I understand that obviously you are a nationally certified medical legal death investigator, a research scientist, an EMS paramedic division chief, and a fire commissioner with lots of community experience, obviously, helping out at the St. John the Baptist and other locations around Charleston. But now I understand you want to run for Charleston County Coroner. Tell me why Frank Broccolo, why now?
Thank you, Quintin. First of all, I would like to thank the Charleston community. I'm so proud of the resilience that the community's had during the last 2 months during this crisis. Our first responders, our medical staff, those keeping us fed in the logistics supply chain, and our military, they have kept us safe, fed, and healthy during the last 2 months. And I'm so proud of the community, how we've partnered together and got along in the last 2 months during this terrible, terrible tragedy. So thank you. I've 19 years been committed to public service at Charleston County, serving the citizens proudly and humbly. And I want to continue that public service for those representing the deceased and advocating for family members that have been survived by unfortunate tragedy.
And I understand on your website you said that you have integrity, leadership, and compassion. And you told me over the phone that, hey, this is your first time in politics and it's new to you. What's new about the Charleston County Coroner's Office that you didn't know before?
Great question. So, as an EMS paramedic division chief, I'm in my 19th year working for Charleston County.
Okay.
And I work with the Charleston County Coroner's Office almost on a nightly basis, unfortunately. EMS, we saved a lot of lives, but unfortunately I deal with death almost every night. And so I already have those relationships and that collaboration with the coroner's office, and therefore I'm ready to lead from day one in this very important elected position.
And you talked earlier about the 2 months that we all experienced due to coronavirus. I want to take you to some developing news coming out of New York, as you may know. Obviously, this is from the Hill newspaper. It reads this: New York City nursing home forced to use refrigerator truck for coronavirus victims' bodies as told near 100. The New York Times: we ran out of space. Bodies piled up as New York struggles to bury its dead. The New York Times, another headline: dozens of decomposed bodies found in trucks at Brooklyn Funeral Home. You talk about integrity, leadership, and compassion. If this were to, God forbid, happen here in Charleston County, what type of integrity and leadership would you use for this situation if it would happen here?
Sure. And the most important thing is we need to be prepared. So every time we have a mass disaster, there's always a preparation. For example, hurricanes.
Right.
There are refrigerated trucks that are available within the state, and they can be relocated and strategically placed within the area so that they can be used if, for example, the morgue at MUSC or the coroner's office, if it is inundated with an increased number of deaths that they're unable to handle. So that is available. It just needs to be pre-planned, pre-positioned, so it can be deployed very strategically if needed.
And what would you do differently on day one?
Exactly. So, first of all, I am qualified from day one. I am already a nationally registered medical legal death investigator. I've got 19 years with Charleston County government. I'm an EMS paramedic division chief, so I have 12 direct reports under me who I supervise on the night shift. I'm also a commissioner on the Charleston County Insurance and Firefighters Inspection Fund, as well as the St. John's Fire District.
Right.
I'm also a nationally registered paramedic.
Right.
So I'm prepared from day one. I've got a master's degree in biomedical science. I'm finishing up a second master's degree in forensic science. I've already got a certificate in forensic science from the University of Florida.
Right.
And I'm a graduate of the Death Investigation Training Academy with a bachelor's degree in biology. So I'm ready from day one to enter this very, very important position because the coroner's office represents the deceased when unexpected and sudden tragic death occurs. And unfortunately, this happens throughout the county. It doesn't matter whether you live downtown Charleston, North Charleston, Isle of Palms, Johns Island, Ravenel. The entire community is affected by the coroner's office, and unfortunately, at most times, the worst times in somebody's life.
If this situation were to happen here with all of these bodies being piled out, and if you were a coroner, what plan would you have in place?
Great question. So first of all, we need to make sure that we know the numbers that we can handle. Partnered with neighboring counties is very important, and it's important to get those relationships ahead of time so that we can work together if we're overwhelmed and our number of death investigators is overwhelmed with the caseload, that we can rely on neighboring counties, our state agencies, and also our federal agencies, and they can send us the resources, additional death investigators, additional locations where the deceased can be compassionately respected and the bodies can be placed in a compassionate location.
Let me turn to a little bit of politics. You probably know about this, but a bill was written years ago in the General Assembly that has helped prevent the spread of communicable diseases, such as the coronavirus, by requiring proper labeling of posthumous patients. What proper label would your office use right now if you were in this situation?
Great question. The most important thing is everybody, whether alive or deceased, we always take what we call universal precautions.
Okay.
So we always need to prepare that everybody has a communicable disease, a transmissible disease until proven otherwise. That's why as a first responder, we always wear gloves, we always wear protective equipment, whether it's eye goggles, gowns, masks if needed. So unfortunately, everybody is presumed to have a disease, a virus, until proven otherwise. So we have to take care of ourselves, as well as the deceased, as well as patients and family members, to prevent spread of diseases.
And if you were to work with the General Assembly right now, what bill would you put together to make sure there's proper labeling for the deceased?
Great question. So we really need to make sure that patients are tested initially, and unfortunately we've had issues with the amount of availability of testing, unfortunately, in Charleston County. There's definitely some progress being made, especially in the next week. You'll hear some very important announcements of some of our underserved and rural areas that are being much better represented on the testing front, because everybody needs to have access to the testing. And unfortunately, at the beginning, it was maybe some of the ones that were closer to a hospital had more access to transportation, and some of our outlying areas and rural and underserved populations have been neglected in the testing process. So it's important to make sure the testing is available to everybody.
You bring me to my next question, because I was going to ask you this. People tell me all the time that there are a lot of underserved members of this community that have issues that affect them. What are the issues right now that relates to the coroner's office that you would fix if you're elected?
Absolutely. First of all, I mean, it's amazing that we're in 2020 and we still have areas in the Charleston County community that don't have a good source of clean drinking water. You know, places like Wadmall, it's a tragedy that people are still using wells. Many of the wells are not up to code, and there's disease transmission from septic tanks. So the basic supplies like well water, we need to have fresh water that all communities are being access to. As well, we still have people at poverty. There's still food issues, are still major issues in this community in 2020.
And what issues, particularly in the coroner's office, would you deal with as far as the underserved community is concerned?
Absolutely. Well, first of all, unfortunately, gun violence, the senseless gun violence, is occurring almost on a daily basis. We hear it on the news almost every day. We're still having fatalities, very young people that are being killed, gun violence. That needs to stop immediately. Also, the drug overdoses. We have a major problem in Charleston County with drug addiction, drug overdoses, and we're having a lot of senseless loss of life that is unnecessary and should be prevented with education and outreach programs.
And let me stay with the obviously the Charleston County Coroner's Office, because there's reportedly a backlog in the existing Coroner's Office. How far back does this backlog go in your mind?
I'm not sure, honestly. I don't know how far the backlog goes, but the population in Charleston, we've had a tremendous growth recently. Charleston County government, the county council, has recently improved over the last several years. They have increased funding for additional positions, which is definitely needed with the population growth. So the coroner's office can keep their death investigator numbers up, so as their caseloads increase, they can also meet the demand and stay caught up with the backlog.
And if you are elected coroner, what comprehensive plan would you use to help expand needs of those growing areas of Charleston County?
Absolutely. So the important thing is we need to make sure that we have representation and a voice to county council, who approves the funding for the coroner's office, so that we can ensure that we have the necessary resources to ensure that we have the same number of death investigators, office staff, administrative staff that can represent our community, so that we can keep up with the growing demand. As we know, Charleston, the population in Charleston is growing tremendously the last couple of years, and unfortunately the growth in the coroner's office has not kept up with that.
And what exact needs to be expanded right now in your mind?
Definitely the number of death investigators. We need more death investigators in the field who are out there investigating and representing the deceased and advocating for the family members every time we have a sudden or unexpected death within Charleston County.
And I know a lot of people I talk to want efficiency in most of these government offices. What will efficiency look like under your administration if you're elected?
Fiscal responsibility is very, very important to me. As a finance member on the Charleston County St. John's Fire District,
Right.
I'm also involved in definitely management of other organizations within the county that help provide budget and monetary fiscal responsibility so that we can spend the taxpayer money wisely and frugally.
And I know people also talk about service. How do you envision service looking like in your office?
Great question. So, number one, I really think that I'm going to build from day one a team that reflects the community we serve. I want to have death investigators that represent our community that can proudly serve the citizens of Charleston County from day one.
From day one. And what will you do on day two?
Day two, excellent. So day two, I need to make sure my staff continues their community education programs. So make sure they continue their certification, their training. Also, I want to make sure that we increase our community outreach and educational programs. The coroner's office really needs to increase participation in events that are out in the community, such as drunk driving awareness, drug and alcohol addiction programs, as well as mental health illness. Those are issues that the coroner's office should be out there collaborating with agencies such as law enforcement, mental health, Charleston Mental Health Agency, and out there letting people know that the coroner's office is an important part of that. As well, we really need to increase at the coroner's office a collaborative effort and environment with partner agencies such as the Coastal Crisis Chaplaincy and the Charleston County Volunteer Rescue Squad. Those are important volunteer agencies that are very integral when there's a death in Charleston County, and a great support system for the surviving family members.
Frank Broccolo, thank you so much for your time. And again, welcome to Quintin's Close-Ups.
Thank you, Quintin, for having me.
You're welcome.